Okay, so what is itis? Itis is basically, if you hear itis at the end of any diagnosis that a doctor gives you, it's just kind of has to deal with inflammation. So bursitis is inflammation of the bursa, tendonitis is inflammation of the tendon, and
you experience the symptoms in your body, which is burning sensation, pulling sensation, and sometimes pain sensation. Might be one of the arthritis, tendonitis, or bursitis, which is bursitis is
inflammation of the bursa.
Exactly, and tendonitis, inflammation of the tendons. It's the hips.
And arthritis is inflammation of the cartilage. Right?
Yeah, it's the damage of your joints, which is movable joints, like your phalange, your knee, and mobile joints, not the stable joints. And
so a lot of reasons why these symptoms occur is because a muscle, it's either improper posture or a disbalance of muscles. So a lot of times, if let's say for instance our bicep is strained or shortened because how much time we spend on the keyboards, how much time we spend on our phone, so this muscle constantly stays in a shortened position. So then when we want to pull, when we are extending our arms out, it's going to give extra pull on the tendon, causing it to stretch and have micro tears, which is going to cause inflammation. Therefore, you have the symptoms of tendonitis. So if you end up working that muscle out, which alleviates the tension from the tendon, it can help your symptoms of tendonitis before they get really bad and it become a chronic tendonitis. If you're just in the acute stage, it's still treatable. There's still things that you can do. If it's chronic, then you have to take other forms of treatment. But same thing with bursa. Bursa is just basically a muscle pulling. Could be your supraspinatus or any of your deltoids pulling on the shoulder capsule, or it could be your pec pulling on your shoulder capsule in a weird way, causing grinding of the bursa, therefore causing inflammation. Same thing with our joints. A lot of times, overuse and the muscles between our fingers are pulling on the joint, causing them to grind with each other, to grind on each other. So these are the things that cause the inflammation response in the body. And some things that we like to use for inflammation is CBD muscle rubs that are, this one specifically we use with our members. And this has turmeric, arnica, which are also anti-inflammatory agents, and they polarize their CBD. And what that means is they almost like supercharge it so that it has a more potent effect on the body and interacts with the body a lot better. And Inflamed is a new product we're kind of testing out right now, but I've used it. It works pretty well, and we're only going to bring you products that we like and that we've used ourselves and we see results from.
This is the easy kind of fix. If you're looking for just take this pain away, but you have to go deep inside. Why is this the problem there? Why we have this pain? Why we have this tendonitis, bursitis? And if this is professional, usually professional people, professional massage therapy, physical therapist or chiropractor, like Michael says, this biceps can be just short, but something happened. It's possible it can happen like an injury, or it's a postural dysfunction. Why it's a postural dysfunction? Because we're sitting and doing same over and over again. Exactly. So bursitis of the shoulders, and just because your shoulders constantly hinge forward, your pecs muscles become super tight, and the most you feel right here. And of course, you go in some place for massage or like spa massage. That's what people do. Basically, they massage right in this area. It's not going to help because the old problem in here. That's why it's really important to find a professional and treat it as fast as possible. Don't ignore this pain. Don't try to take the pills. Pills might work. Some of them work.
Pills treat the symptoms of the problem so that you're not in pain, but it's not helping you.
And it's damaged your liver, your kidney, and your stomach. It's all your flora and fauna in your body have to be balanced. When you get this balance off, everything gets off. This is all life about the balance. So keep the balance right. So the postural, because we're doing constantly same job over and over, it's become a problem. Another like arthritis, we don't use a lot of fluids. We do a lot of sugar We drink a lot of coffee, which absorb your water, so you need to drink constantly water, especially in California. It's super hot right now. Dry. You need to drink all the time water. If you don't drink water, it's caused a lot of problems like kidney stones and that joints problem, which is arthritis. And it's really important, of course, to take care of it right away. Massage, it's a #1 treatment, and of course physical exercise, which is get you back to the full range of motion, and this is important. But of course, we're looking for easy ways, easy fix.
Well, we're gonna attach a couple resources that might help if you have been, you know, labeled with these symptoms. You know, there's different trigger points and different muscles that you can stretch to help take away a lot of the problem for that area. So like, you know, if you work the muscle that's pulling on the tendon, it's going to relieve a lot of the tendon strain. If you start to fix your posture and start to get your shoulders upright, keep your chest up, you know, it's going to take a lot of the postural problems that's causing the grinding of the bursa, that's causing the inflammation.
Yeah. This is why we do exercise. We activate one of group muscle to help other muscles, like to balance your body. That's like I said, if we hunch forward, we need to activate back muscle to bring this shoulder back. This is really important to know what you're doing, and of course ask, like I said,
a good way to look at it is basically your body's gonna form to the position that you're constantly in all the time. So if you're constantly looking over at your desk, like, do you want to walk around life like this? So just always remember that, you know, your body's going to form to whatever position you are in the longest term.
Yeah.
So, you know, there's just a lot of different things that you can do. Muscles are a big factor in a lot of these diagnoses. So like even if somebody gets labeled with the symptom of arthritis in the spine, it could be muscles just compressing the discs, right?
Exactly. The most dangerous thing when you self-diagnose.
Yes.
You self-diagnose. You don't have this. You don't know nothing about it. You self-diagnose, and what's the problem is your mind start processing, progressing, creating.
If you're telling your mind, I have this,
exactly,
your mind is gonna prove you right, and it wants to prove you right. So that's why the words that you use and the things that you say are very important. If you walk in and say, "Oh, I have a messed up body. My body's so messed up," it's like, okay, yeah. Your brain hears you say that. Your body's gonna respond to you saying things like that. So please, let's use nicer words to describe yourself.
Yeah, it's from my 14 years experience of massages. Some people come in with the pain, and you try to find out and you don't see the postural problem, but the pain's still there, and it's months and months and months you work on this person, and you just find out it's everything in the head, the inflammation in the head, which is spread in your body, and you feel it. Same with the fibromyalgia. It's just it's really deep. It's you guys looking for more researchers on that, but yeah, 76% pain in your body created by your mind. So stay away from this.
Yeah,
stay away from self-diagnose.
Do not self-diagnose. You know, try to explore as many options before going to the most extreme, cutting your body open and, you know, doing things like that. You know, just try other things. You know, it's just try to avoid being on the surgery table. You know what I mean? There's just other options that you can do.
This is last thing you want to do. This is last thing. If you agree to do surgery right away after this is not the action. You're gonna get in a new trouble because the surgery caused different postural problems.
You're cutting fascia. You're cutting the skin open. Like it's not just I'm open, it's fixed, and it's closed. There's scar tissue there that's gonna develop. So it's just wise to just try to use all forms of resources to help with whatever symptoms or labels that somebody's giving you, so that, you know, you can try to help relieve a lot of your pain, you know, with that as little as dramatic measures.
Yeah. So guys, it's arthritis. We know bursitis. It's not a pleasant experience in your body. So don't wait. Even 2-3 weeks. If you wait for 2-3 weeks, it's going to create chronic pain, and it's constantly going to be pain in your body. And this might be later turn to something more bigger and bigger, because pain and problems never go away. It just, your body just start adapting, if you know what I mean. If I feel pain, my body start less using that elbow, and later maybe I can't even move. It become like a frozen shoulders or something, because my body don't want to move that part. I don't want to experience the pain in my body. So this is really important to take care of this. And professional massage therapists, they know what they're doing. We can't diagnose it, but we can work and see what's going on, because it's couple tests gonna show this up right away if you have arthritis or tendonitis or bursitis. So the little tip for arthritis or tendonitis or bursitis, stretch the muscle. If this is the pain is when you stretch, you experience pain. Don't stretch, because you don't want to go through this pain. Maybe yes, use inflammatory gels like a Quanta with the arnica mint. It's going to help a lot. Decreasing, get some little bit activity.
Don't do anything. Don't do anything that causes strain in the affected area. Yeah. Always listen to your body. It's never a good idea to push through the pain. You know, a lot of things is, you know, your brain is trying to protect. Your brain is always trying to protect you from pain. So people with frozen shoulders, there's something going on with that shoulder, and your brain is like, okay, let's not move it because it hurts too much to move it. So let's create adhesions in this capsule so that we can not move it and not deal with this kind of pain. So just remember, your brain is always just trying to protect you. So don't ignore things that you start to see, and when you start realizing like, oh, I don't need to use my left foot as much because it hurts. Oh, I don't want to use my left arm to open things because I have weak grip in there. Yeah. Any of these signs are signs that you should need to do something about the muscle, or maybe this muscle's not firing off properly. So this is a good sign for you to seek a professional massage therapist to help with these conditions.
Yes, it's a lot of like joint pills, like joint health, joint rehab. Mm-hmm. It's completely organic. It's completely natural. It's no any chemical stuff. It's a fish oil too. Omega-3, omega-6 is really important for your joint capsule. It's like I said, fluid for your tendonitis, bursitis. It's might be good stretches. Maybe yoga is gonna help. Some people like cold, some people like heat. I prefer heat because I'm more, I know it's kind of uncomfortable in the beginning, but later you feel much better because your muscles get a little bit relaxed and they like a natural way stretch. And also, but Michael suggests ice. Actually, I don't think so. Like
yeah, you know, it's the body's response to something. You know, like a cut or a bruise or something, is to create an inflammatory response. Yeah. So therefore you are counteracting your body's natural responses when you ice it, but it will bring the inflammation down and it will make it a little more bearable. So it's just kind of, you know, there's different frames of thought about that, but like it, you know, okay, ice is good for the symptoms, but it's not good for the long-term, you know, healing of the area. But you know, it'll help just kind of numb it.
Yeah, in the long term, like you said, that's right. Yeah. Heat, it's always work much better. I know if you have like an MS or fibromyalgia, it's not going to be the good idea to apply that heat because you probably hate heat. I know a couple of clients with a fibromyalgia come here, they don't like the heat. But we're not going to go there today. We'll talk about itis family. So.
Thank you for watching. I hope we've helped and just kind of open some new ideas for you to help with whatever you've been labeled with. Yeah. So this is Massage RX. Stay healthy, stay happy, and try to live as pain-free as possible.
Learn about your body, because this is only you have. You came this world with this body. You grow this body up, and when you get older, it's not pleasant. It's not pleasant, so you have to learn about yourself, about the body, how to go through this life period. So, like Michael says, enjoy your day, be knowledgeable about your body.
Thanks for watching.
Thanks, bye.